On this Tuesday night, the Delta variant and children. COVID compounds the back-to-school jitters again.
Not just me, I'm worried about the people around me.
Plus, how politics affect public health measures.
There's a considerable degree of divisiveness in our country.
Our interview with Dr. Anthony Fauci. The damning findings of a sexual misconduct investigation into New York's governor and his denials.
That's not who I have ever been.
A Belarusian activist exiled to Ukraine and found dead. The suspicions he was murdered. Plus, a beloved basketball superstar takes a pass on Toronto.
I'm so sad.
Kyle Lowry's legacy on and off the court.
Global National with Donna Friesen. Reporting tonight, Farah Nasser.
Good evening, and thank you for joining us. We begin with the big question on the minds of Canadian parents and students. With September fast approaching and warnings of a potential Delta-driven fourth wave, what will the coming school year look like? And what's being done to help keep kids safe? Today, the Ontario government unveiled its roadmap for September. It plans to have all students back in the classroom in person unless they opt for remote learning. Masks will be required indoors for grades 1 and up. School boards are being told to be ready to quickly shift to remote learning if needed, though the province's top doctor says he's confident closures won't be necessary.
I really don't see our schools closing going into the fall and winter and spring. And I believe that's the same stance of all of our medical officers of health. We will do our utmost to keep schools open for all students and families.
One of the big variables is the Delta variant. Now, there's no evidence kids are more at risk. But the problem is there is no vaccine available for children under 12, and that won't change by September. In tonight's top story, Abigail Bimman breaks down what we know about Delta and kids and what experts are watching for.
One child in the hospital from a vaccine-preventable disease is unacceptable.
Daily protests in Edmonton and Calgary since the Alberta government announced a big easing of the rules.
My greatest fear as a pediatrician and as a mother is that we're going to see children hospitalized.
One of the big issues for Dr. Taysine Latta, masks won't be mandatory in classrooms this fall.
I want to try my best to keep everyone safe, and I'll continue wearing my mask.
Ontario students must wear masks. That province released its back-to-school roadmap Tuesday.
I think we have to normalize COVID-19 for schools and have an approach that's prudent, that's cautious, but that realizes, we're going to have a rise in cases.
The backdrop to back-to-school planning and worries, rising cases of the Delta variant, combined with children under 12 who can't get vaccinated, even though in general, severe outcomes for children with COVID-19 are very rare.
I can't say that the Delta variant will cause more severe disease than other COVID infections in kids.
Dr. Jesse Papenburg says because Delta is more transmissible, there will be more cases, but there is no data showing it causes more severe outcomes in children.
Will we see more hospitalizations overall in the coming weeks and months? I have no doubt. Will that be reflected in pediatrics? Probably. But right now, I wouldn't say that there's any cause for alarm at this point.
Children's hospitals in Calgary, Toronto, Ottawa, and Montreal tell Global News they have not seen an increase in pediatric admissions recently. But there are reminders cases do happen. Some Ontario campers had a very short stay after an outbreak among at least 4 campers and staff forced Muskoka Woods to shut down.
For 4 hours, it was fun. And then the counselor came in, we got the COVID alert, and then everyone just packed in a panic, kind of.
As for when children under 12 could be approved for a vaccine, it certainly won't be before the school year. Clinical trials, including with Canadian kids, are in the works with early results expected by the fall, but full results and an application to Health Canada are not expected until the end of the year. Abigail Bimman, Global News, Ottawa.
Now to the U.S. and Florida specifically, where a major surge in infections and low vaccination rates in some areas is having an alarming impact on children. According to the U.S. CDC, the average number of children hospitalized with COVID-19 in Florida has jumped 53% compared to the previous week. On average, 40 children were admitted per day. In total last week, the Florida Department of Health reported more than 10,700 new infections. That's in children under the age of 12. New York City will soon require proof of vaccination for indoor dining, gyms, and performances.
If you're vaccinated, all that's going to open up to you. You'll have the key. You can open the door.
Vaccinated Americans will receive a so-called Key to NYC pass. It's going to provide proof of vaccination for indoor activities. New York will be the first U.S. city to impose such restrictions. They will be enforced as of September 13th. Mayor Bill de Blasio says the move is crucial to encourage more vaccinations. Less than 50% of all eligible Americans are fully vaccinated. Once a leader, the U.S. has now fallen behind Canada and the EU. Our Jackson Proskow recently sat down with Dr. Anthony Fauci, the top infectious disease expert in the U.S., to talk about how politics has impacted public health measures.
You know, the vaccination rate in this country has really struggled to get above that 50% of eligible people fully vaccinated. There was so much hope and optimism when these vaccines rolled out at the start of the year. I'm wondering, from where you sit, would you have predicted that it would be this much of a struggle to get this much of the American public vaccinated?
No, I was hoping that we would get an enthusiasm that would transcend political ideology, transcend leaning towards one versus the other, depending where you live and what the general culture is in a particular area. But unfortunately, that's not the case. Where we've been stuck now is we have about 100 million people who are eligible to be vaccinated who are not getting vaccinated. And we've really got to do anything we possibly can to reach out to them, to get trusted messengers, and even in some respects, to do some local mandating, which we're starting to see in the country. You're going to see universities, colleges, places of business that are going to require vaccination. Once that happens, you're going to start seeing more people vaccinated.
Is there something different in the U.S. that's made it more difficult here?
I think it's no surprise to anyone. Certainly across the border, you recognize it, you're close to us, that there's a considerable degree of divisiveness in our country. And unfortunately, that's spilled over into the public health arena.
Has the Delta variant made the politics even more difficult? Because you've got people thinking now that we're taking a step backwards. We're returning to mask recommendations and mandates, for example, all the issues we dealt with months and months ago.
Yeah, it just intensifies things, because for the people who are saying that one thing makes a difference or doesn't make a difference, it adds a lot more confusion to it. We're dealing with a different virus now than we were several months ago. And that being the case, the science evolves, the evidence evolves, and your approach and your guidelines and your recommendations need to evolve.
You can watch Jackson's full interview with Dr. Fauci on our website, globalnews.ca/globalnational. Canada is still number one in the world, with more than 67% of eligible people fully vaccinated. And though rates have plateaued, we still have millions of doses coming in, while countries like the Philippines, Kenya, Iran, and Egypt have single-digit vaccination rates. Michael Couture reports on Canada's unused doses and our COVAX commitments.
Over the last week, the number of doses being administered daily in Canada has dropped by half. And it's a problem for two reasons. Not only does it mean fewer people are being protected against COVID-19, but it means some doses could go to waste.
No healthcare provider wants to be in the precarious position of having to dispose of what is liquid gold in the vaccines.
When the vaccines arrive in Canada, they're stored in freezers. The provinces place orders for how many doses they believe they'll need a month ahead of time, and those doses are shipped to doctors' offices, pharmacies, and vaccination centers. But then the clock starts ticking.
Once they're thawed, you really have about 28 days to use those vaccines. And you can't refreeze them or repackage them and put them back in the box and send them elsewhere. They've got to be used.
Dr. Bogosh is part of Ontario's vaccine task force, and he points out there has been far less wastage in the COVID-19 vaccination campaign compared to the seasonal flu. Those soon-to-be expiring doses can be moved across the province to other regions, but it's just too complicated to donate them to developing countries.
If you look at the time to extract, to do the quality assurance, to inspect every single vial to make sure they're not spoiled, and then to ship it, It's going to take longer than a couple of weeks.
While some doses have already gone to waste, the government is making sure the developing world gets vaccines. According to Gavi, the Vaccine Alliance, Canada is fourth in the world when it comes to donating doses of COVID-19 vaccine to the rest of the world, just ahead of Japan. That's in addition to the hundreds of millions of dollars pledged to purchase vaccines for poorer countries. A spokesperson from the Department of International Development acknowledged there is some vaccine wastage in Canada, but added it's less than 1% of the nearly 60 million doses that have been delivered to the provinces. Farah?
Michael Couture in Ottawa. Thank you, Mike. U.S. President Joe Biden is calling on New York Governor Andrew Cuomo to resign. A bombshell report from the state's attorney general found Cuomo sexually harassed at least 11 women, and his office is accused of creating a toxic work environment that prevented women from coming forward, and even retaliated against one accuser who went public. And we want to warn you, some of the details here are disturbing.
This investigation has revealed conduct that corrodes the very fabric and character of our state government.
Attorney General Letitia James says Cuomo and his office violated state and federal laws. The Democratic governor's accusers include 9 current and former employees. 1 was a state trooper and a member of a security detail. The independent investigation corroborated the accusations by conducting nearly 180 interviews and examining more than 74,000 pieces of evidence, including emails, text messages, audio files, and photos. Cuomo, who has faced calls to resign for months, denied the allegations in a pre-recorded video address.
I never touched anyone inappropriately or made inappropriate sexual advances.
The Attorney General says the investigation was a civil matter and any criminal charges will be up to law enforcement. In Afghanistan tonight, a bomb went off near what's known as the Green Zone in the capital city of Kabul. It's another sign of volatility as Afghan forces combat a Taliban resurgence. The car bomb was detonated not far from the home of the country's defense minister. A short time later, another blast and gunfire in the same area. There has been no claim of responsibility. It happened as the government urged civilians in the capital of Helmand province to evacuate, where security forces struggle to fend off the Taliban. The militant group is fighting to seize more territory throughout Afghanistan ahead of the withdrawal of U.S. and NATO troops after nearly 20 years in the country. And as the Taliban gains ground, the Canadian government is facing pressure to act faster, to resettle Afghans whose lives are at risk because they're past work helping Canadian forces.
The threat is real and it requires immediate action.
Advocates took their message to Parliament Hill. They want the federal government to expedite the application process for former interpreters and support staff and family members. There are fears the Taliban will retaliate or murder those who were seen as cooperating with foreign forces. Last week, the U.S. brought in 200 former interpreters and family members, and on Monday, it expanded the eligibility for refugee status. In Montreal, 3 men are dead and 2 others injured after a brazen shooting that's believed to be gang-related. Police say dozens of shots were fired toward an apartment building around 7 Monday night. All the victims are known to police. Officers say the violence is unprecedented in Montreal. Police have asked Quebec's National Police Force for specialized support to prevent potential retaliation. A prominent activist from Belarus is found dead in Ukraine. Coming up, the suspicions and the fears he was murdered. An exiled Belarusian activist has been found dead in the Ukrainian capital. Vitaly Shishov was discovered hanged in a park. The main opposition leader of Belarus says she too could disappear at any moment. Redmond Shannon reports on the growing fears of being targeted outside the country.
A friend and colleague of Vitaly Shishov describes the jogging route the activist took Monday. The body of the Belarusian was later found hanging from a nearby tree. He called me last week and said he had a bad feeling, says the friend, and that if anything happened, I should look after his girlfriend. Kyiv police say they are investigating whether it was suicide or murder. Shishov was the head of a group that helps Belarusians in exile. If it was a targeted murder, it sends a chilling message to those who have fled to Ukraine. Like the husband of Belarusian sprinter Kristina Timanovskaya. They are both desperate to get to Poland after she criticized her Olympic coach in Tokyo, a sporting spat that thrust her into the opposition movement and the international spotlight. The leader of the opposition movement, Svetlana Tikhanovskaya, has been meeting Western leaders in recent months, asking them to put more pressure on the regime of President Alexander Lukashenko. Her latest stop here in Downing Street.
We are committed to supporting human rights and civil society in Belarus.
After her meeting with Prime Minister Boris Johnson, Tikhanovskaya reflected a growing fear that Belarusians outside the country are feeling unsafe.
I can disappear at any moment. I understand this, but I should do what I'm doing. I can't stop because I'm. I feel this responsibility for the future of my country.
A fear shared by some Belarusians in Canada.
I worry about a lot of my colleagues, even here in Canada. Two of my colleagues who are activists and work with me, they've been on Belarusian propaganda TV with some threats that they will be investigated and exposed.
Activists like Elena Leovonchenka say the repression in Belarus continues and is getting worse ahead of the one-year anniversary of the disputed election next week. Redmond Shannon, Global News, London.
Ahead, the Olympic gymnasts back on the beam, overcoming mental and physical adversity. Two big comebacks were front and center at the Olympics today. American gymnast Simone Biles returned for the highly anticipated balance beam final, and Canada's Ellie Black also re-entered competition. Crystal Gamansing has the results and details about a record day on the track.
Simone Biles put herself and her health first. Returning to competition on the final day, she showed her strength. She altered her routine, but still earned a bronze, her 7th Olympic medal in her accomplished career.
I'm pretty happy. I wasn't expecting to medal. I just came out here and just tried to do a good beam set.
The games have been tough on the world-renowned gymnast. She qualified for 5 events and was heavily favored to win multiple golds. But the 24-year-old was struggling with her mental health and pulled out of all but this event. Canada's Ellie Black supported her fellow gymnast, calling her courageous. Black also just returned to competition after injuring her left ankle in Tokyo. Black is the top Canadian female gymnast, and she was determined to have a strong finish. Her performance impressed. She scored a personal best. It left her briefly in 3rd place, but she was edged off the podium by 16-year-old Guan Cheng, who captured gold. Afterwards, Black said that it's been tough, but she's proud of her performance. While the nation's medal count didn't move, records did fall on the track. Andre DeGrasse set a new Canadian record in the 200-meter sprint semifinals, finishing in just 19.73 seconds. Fellow Canadian Aaron Brown finished his heat just a little slower at 19.99. In his heat, 3 sprinters appeared to cross the finish line at the exact moment. A review determined Brown finished first. That means in the field of 9 sprinters, there will be 2 Canadians in the final, doubling the country's odds of capturing a medal Wednesday. DeGrasse did win silver in this event back in Rio. Crystal Gamansing, Global News, London.
Kyle Lowry says goodbye to the Raptors. Up next, the legacy he's left in Toronto. It's a bittersweet end of an era for Canadian basketball. Yesterday, NBA player Kyle Lowry made it official. He's saying goodbye to the Toronto Raptors to play for the Miami Heat. As Sean O'Shea explains, he leaves behind legions of fans forever grateful, even as they see him go.
In the annals of Toronto sports, Kyle Lowry's name looms much taller than the guard's 6-foot frame.
He's the face of the franchise for the Toronto Raptors, but a basketball player who had a shaky start here 9 years ago.
Guy with a okay, iffy reputation and as a bit of a hothead and a guy who butts head with coaches to this beloved teammate.
Lowry made his mark with the team and the fans during the Raptors' 2019 playoff run, ending with a first-ever championship. Off the court, Lowry was frequently just as entertaining.
We have a special guest here.
Like taking a press conference phone call from his friend, the rapper Drake.
I'm his translator.
You're not. No.
Or when he received an honorary doctorate from Acadia University this spring.
I will not respond to anything other than Dr. Lowry.
What kind of doctor are you going to be? Doctor of letters or doctor of what?
Doctor of greatness.
At the same time, Lowry connected with people through his charitable foundation and his motivating words.
How will you pay it forward? What will be your impact on your community?
In Lowry Square in East Toronto, a street sharing the superstar's name,
we're very proud as a Torontonians.
A young family moved into their house just a couple of days ago, just as Lowry moves out of the city.
I know it's hard to say goodbye to him, but we could still see him like in another court.
It hurts, but he has to be one of the greatest Raptors of all time.
It's sad. He's first of all, the greatest Raptor of all time.
Lowry's moving to the Miami Heat for a reported $90 million 3-year contract and a shot at another championship ring.
It's going to be a little weird to watch a Raptor team without him.
Let's go Raptors!
The end of an era, but in a city that was starved for a sports championship, Lowry's legacy as the driving force behind it is sealed. Sean O'Shea, Global News, Toronto.
And that is Global National for this Tuesday. I'm Farah Nasser. Thank you so much for spending part of your evening with us. Tonight's York Canada is the Terry Fox Monument in Thunder Bay, Ontario. Until tomorrow, take care of yourselves and each other.